Welcome to This Week in Ophthalmology. This week we're covering 10 notable papers spanning artificial intelligence and gene therapy, retinal, vascular, and macular disorders, surgical innovations in the anterior segment, and advanced diagnostic imaging. Let's dive in. Artificial intelligence and gene therapies are increasingly shaping the management of complex, inherited, and degenerative retinal diseases. In a multicenter randomized trial, GI and colleagues evaluated Retina 4IRD, an artificial intelligence-based clinical decision support system designed to predict 17 genotype categories from retinal images using a vision transformer model. In testing involving 295 participants with suspected inherited retinal diseases, the top 5 genetic accuracy was significantly higher in the AI-assisted specialist arm, at 88.5%, compared to 67.3% in the specialist-only arm, with corresponding downstream management scores also favoring AI assistance. Meanwhile, moving from diagnostics to therapeutics, Nagil and colleagues reported interim results from a prospective observational safety study in ophthalmology, evaluating long-term safety and outcomes of voretigene neparvovec RZYL in 87 patients across United States clinical treatment centers. With a median follow-up of nearly 4 years, treatment-emergent adverse events occurred in 95% of patients, and chorioretinal atrophy occurred in 28% of eyes, typically within the first year. Importantly, chorioretinal atrophy risk was markedly higher with automated foot pedal administration and in patients with myopia, though treated eyes maintained sustained visual acuity and full-field stimulus threshold improvements. Addressing neurodevelopmental safety in premature infants, an American Academy of Ophthalmology assessment published in Ophthalmology reviewed 26 studies comparing intravitreal antivascular endothelial growth factor therapy with laser photocoagulation for retinopathy of prematurity. The majority of studies detected no statistically significant difference in neurodevelopmental outcomes between the two treatment modalities, and intelligence quotient testing beyond 4 years showed no significant differences, though no studies were specifically powered for neurodevelopmental endpoints. Turning to retinal vascular disease and macular degeneration, several studies investigate longitudinal non-perfusion, treatment extension strategies, and non-exudative fluid dynamics. Al-Halali and colleagues performed a post-hoc analysis of the Kingfisher trial, utilizing ultra-widefield fluorescein angiography to compare retinal non-perfusion in patients with diabetic macular edema treated monthly with brolucizumab versus aflibercept over 52 weeks. Over the 52-week period, neither brolucizumab nor aflibercept demonstrated a statistically significant change in retinal non-perfusion indices across posterior, peripheral, or panretinal zones, with no significant differences detected between the two agents. In a multicenter randomized trial, Mikulich and investigators assessed whether high-need neovascular age-related macular degeneration eyes requiring aflibercept every 3 to 5 weeks could successfully extend treatment intervals when switched to faricimab. During the comparator-controlled period, significantly more faricimab-treated eyes achieved successful interval extensions of at least 2 weeks compared to aflibercept-treated eyes, and switching uncontrolled eyes to faricimab significantly reduced central subfield thickness. Expanding our understanding of imaging artifacts, Vienjumeau and colleagues published a comprehensive review in the Survey of Ophthalmology detailing non-exudative retinal fluid in age-related macular degeneration. The authors emphasized that intraretinal and subretinal fluid can arise from non-neovascular mechanisms, such as degenerative processes, mechanical traction, or retinal pigment epithelium pump failure over drusen, signaling advanced tissue stress and increased risk of geographic atrophy rather than neovascular exudation requiring antivascular endothelial growth factor therapy. Anterior segment innovations offer promising lens-preserving options and tissue-engineered constructs for challenging ocular surface disorders. Ogino and colleagues evaluated cultured human corneal endothelial cell injection therapy in phakic eyes with bullous keratopathy in a multicenter retrospective case series. Across 5 phakic eyes followed for 6 months, mean best-corrected visual acuity significantly improved, mean central corneal thickness decreased by 204 microns, and corneal clarity remains stable without intraoperative complications, cystoid macular edema, or clinically significant cataract progression. For advanced anterior-related keratopathy, Kay and colleagues conducted a single-arm open-label clinical trial published in JAMA Ophthalmology assessing a tissue-engineered collagen scaffold, incorporating allogeneic limbal epithelial stem cells and stromal keratocytes, known as RAFT-OS. In 9 adult participants, the transplant was feasible and associated with early ocular surface score improvements that were partly sustained through 12 months, though one early serious adverse event prompted a manufacturing protocol amendment. In pediatric oncology, XU and colleagues reported a retrospective cohort study in ophthalmology evaluating eye-preserving therapies for early cohort 3C retinoblastoma presenting with neovascular glaucoma without ophthalmos. Comparing 50 primary enucleation patients with 82 primary eye-preserving patients over a median follow-up of 52.9 months, overall survival did not differ significantly between groups. Globe salvage was achieved in nearly half of the preserved eyes, with intraarterial chemotherapy and cryotherapy demonstrating significant association with better salvage outcomes, while baseline corneal edema and intraocular pressure of 32 millimeters of mercury or higher were identified as risk factors for salvage failure. Finally, imaging protocols continue to evolve in diabetic retinopathy. Santos and colleagues conducted a prospective study published in the British Journal of Ophthalmology, evaluating agreement between the standard early treatment diabetic retinopathy study 7-field protocol and ultra-wide-field imaging systems, specifically Claris and Optos, in 147 eyes with non-proliferative diabetic retinopathy. Both Claris and Optos showed strong agreement with the early treatment diabetic retinopathy study grading system for severity levels, with extended ultra-wide-field imaging capturing peripheral lesions that helped identify more advanced disease, supporting ultra-wide-field systems as viable alternatives in clinical practice and trials. If you only have time for one paper this week, make it the evaluation of Retina 4 IRD by Gia and colleagues in Nature Medicine. This multicenter randomized trial demonstrates that an artificial intelligence-based clinical decision support system can substantially improve clinician genotype prediction accuracy and downstream management decisions for suspected inherited retinal diseases, offering a valuable pathway to bridge the gap in specialist expertise. Here are the key takeaways from This Week in Ophthalmology. Artificial intelligence decision support significantly enhances diagnostic and management accuracy for inherited retinal diseases prior to genetic testing. Long-term safety data for voretigene neparvovec RZYL confirm sustained visual improvements despite a measurable incidence of mild chorioretinal atrophy, particularly associated with automated foot pedal delivery and myopia. Ultra-wide-field imaging systems demonstrate strong agreement with standard 7-field protocols for diabetic retinopathy severity grading while capturing clinically relevant peripheral lesions. Cultured human corneal endothelial cell injection therapy and tissue-engineered corneal scaffolds show encouraging short-term safety and efficacy for bullous keratopathy and advanced aniridia-related keratopathy. Finally, recognizing non-exudative retinal fluid mechanisms in age-related macular degeneration prevents unnecessary antivascular endothelial growth factor injections, and refines prognostic assessment for geographic atrophy. That's your roundup for This Week in Ophthalmology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.